Hello, welcome to Sobriety Made Simple. My name is Timothy Martin. Today's video is on a topic that has an effect on all of us that abuse or have abused alcohol. It's alcohol-associated liver disease. There are three main types, and many individuals who consume alcohol over a long period of time process through these disease types very quickly. The first one is called steatotic fatty liver. Steatosis is the buildup of fat inside the liver cells. It leads to an enlarged liver. Steatotic liver is the most common alcohol-induced liver problem. Number 2, acute hepatitis. Alcohol-associated hepatitis is an acute inflammation of the liver. There is death of liver cells, often followed by permanent scarring. And number 3 is cirrhosis. Alcohol-associated cirrhosis is the destruction of normal liver tissue. It leaves scar tissue in place of the working liver tissue. Now, before I go any further, a small explanation on the liver and what it does. The liver is a large organ that sits up under the ribs of the right side of the belly. The liver helps filter waste from the body. It makes bile to help digest food, stores sugar that the body uses for energy, makes proteins that work in many places in the body. For example, proteins that cause blood to clot. What causes alcohol-associated liver disease? Alcohol-associated liver disease is caused by heavy use of alcohol. The liver's job is to break down alcohol. If you drink more than it can process, it becomes badly damaged. Steatotic fatty liver, alcohol-associated hepatitis, and cirrhosis are linked to long-term unhealthy alcohol use. Okay, you're probably asking, what is unhealthy or heavy alcohol use? As of 2024, the National Institute of Health defines heavy alcohol use for men as consuming 5 or more drinks on any day or 15 or more drinks per week. For women, it's consuming 4 or more drinks on any given day or 8 or more drinks per week. Okay, well, what exactly does a drink mean? One standard drink has about 14 grams of pure alcohol ethanol in it. Some examples include 12 fluid ounces of beer, 5 fluid ounces of table wine, and 1 shot of distilled spirits, gin, whiskey, or vodka, for example. Okay, what are some of the symptoms of alcohol-associated liver disease? Symptoms of alcohol-associated liver disease may differ depending on how much and how long you've been consuming alcohol. These are the most common symptoms, though. The buildup of fat inside the liver cells, discomfort on the right side of the abdomen, tiredness, weakness, weight loss. Now, acute hepatitis and cirrhosis share these symptoms: fever, weakness, abdominal pain or discomfort, nausea and vomiting, appetite loss, weight loss, yellowing of the skin and eyes, which is known as jaundice, reduced blood flow through the liver due to increased resistance, hypertension and enlarged spleen, bleeding in the gastrointestinal tract, fluid building up in the belly which causes a bloated look to the abdomen, increased risk of infections, kidney failure.
Kidneys aren't functioning efficiently, your liver's failing you. You need to make some lifestyle changes.
The symptoms of alcohol-associated liver disease may look like other health problems. This is why it can be hard to diagnose. If you feel or see any of these things, please see a healthcare professional right away for a better diagnosis, okay? Now, how are these things diagnosed, you might ask? How is alcohol-associated liver disease diagnosed? Your healthcare provider will do a complete health history and physical examination. The tests used to diagnose alcohol-associated liver disease may include the following: blood test. These include testing the liver enzymes, which show whether your liver is working properly the way it should, and how advanced your liver disease may be. A liver biopsy. This involves removing a small amount of your liver with a needle during surgery. These samples will be checked under a microscope to find out the extent of liver disease. Ultrasound. This test uses high-frequency sound waves to create a picture of the organs. A CT scan. This imaging test uses X-rays and a computer to make detailed images of any part of your body, including the bones and muscles, fat, and in our case, your liver. CT scans are more detailed than a general X-ray. Sometimes injecting dye into the vein is done to help show the liver and the other organs in the belly. An MRI uses a magnetic field radio frequency pulse and a computer to make detailed pictures of internal body structure. Sometimes injecting dye into a vein is done to help show the liver and other organs in the belly. How is alcohol-associated liver disease treated? The aim of treatment is to restore some or all normal function to the liver. And this is one of the best things about the liver. It can actually heal itself if you stop in time. And do yourself a favor, please stop consuming all alcohol as soon as possible. If you have acute hepatitis or cirrhosis, think about participating in an alcohol use disorder treatment program. It can help you achieve this important goal. With complete alcohol avoidance and time, the liver can often heal some of the damage done from alcohol. Scarring from cirrhosis is sometimes partially reversible. However, with too much time of hard, heavy drinking, the liver tissue loss is severe enough to cause failure. Most of this kind of damage can be permanent. So it is important that you stop now, please. In some cases, a liver transplant might have to be considered. A lot of people are embarrassed to tell their healthcare provider about their alcohol use, but please, you have to overcome this if you want to get better. Now, what are the possible complications of alcohol-associated liver disease? People with alcohol-associated liver disease are at an increased risk for having hepatitis C or possibly hepatitis B. People with alcohol-associated acute hepatitis or cirrhosis often develop kidney problems, gastrointestinal bleeding, fluid in the belly, liver cancer, and severe infections, which can lead to death. All right, to sum up, here's some key points about alcohol-associated liver disease. Alcohol-associated liver disease is a preventable disease. It's caused by heavy use of alcohol. One of the functions of the liver is to break down alcohol. If you consume more alcohol than a liver can process, it can become seriously damaged. The effects of alcohol on the liver depend on how much and how long you've been drinking. The most important part of treatment is to stop drinking alcohol completely. With complete alcohol avoidance and time, the liver can often heal some of the damage done from alcohol.
Your liver is already in trouble.
Now, in my case, I could definitely check off a few of these boxes. And this was a big reason why I decided to stop drinking in the first place. My health was starting to become an issue. I drank for many, many years, over 20. So trust me, don't let it get to this point, okay? Please consider consulting a doctor and being honest about your alcohol use. Abstinence is the key. Stop now before it gets too late, okay? Also, if you're still in active drinking, please consider taking a thiamine B1 supplement. I have a video on it, okay? Please watch it. I hope this video helps you out, okay? Thanks for watching, and we'll see you in the next one. And remember, you got this, okay? Bye.